Hello everyone, I'm Clifton Irahuka, a medical officer specializing in maternal and child health. I work at Makerere University Hospital and I'm part of Kampala Central Church Health Ministries. I'm here to talk to you about cervical cancer. Cervical cancer, like all other cancers, is uncontrolled growth of cells that make up the cervix. The cervix is part of a reproductive organs of females or women. Cervical cancer contributes up to 40% of all cancers that affect women, meaning that out of every 10 that you see that have cancer, 4 of them have cervical cancer. And about 4,000 women die due to this cancer. About 6,000 new cases are registered annually, according to data published by Uganda Cancer Institute. So we feel it is a problem big enough to have our attention. Cervical cancer is caused by a virus called human papilloma virus. And there are risk factors like one, having multiple concurrent sexual partners, because this virus can be carried by men. So, but men are not affected by it, by the way, to get the cancer, but they can transmit it from one woman to another. So it's transmitted by men, and um, so having multiple concurrent sexual partners actually increases one's risk. And also in Uganda, our HIV prevalence is around 5.4%. So those who are HIV positive also have an increased risk of contracting cervical cancer. There are other several risk factors that I could talk of, like our cultural practices, not being able to seek care early and maybe screen such that you understand that you could be having the cancer developing itself. So how would one know that they could be developing this cancer? Usually bleeding, which most often is after sex, we call it postcoital bleeding. Then sometimes people see abnormal, like false smelling discharge coming out from their private parts down there. And then of course, we also, for some, they start, if it's advanced, they experience other things like weight loss, their legs can swell, they start getting sweats, and several other symptoms. So what can be done? We do screening. We have different tests. We can do pap smear. This we can do it assisted by the health workers or even self-assisting, and we train you on how to do it, and we are able to get the sample. We have other several tests that we can use to find out, especially when one is still at the early stages of the cancer. And should there be signs that indicate one might be developing the cancer, we carry out further advanced tests to indeed confirm. Cervical cancer is treated, we can cure it, but the chances of curing it depend on how early it has been diagnosed. About more than 70% can be treated and cured if at all we recognize it at the earliest stage possible. We can also prevent it. We do vaccination, especially among young girls aged 9 to 14 years. Those who are even still in school, we vaccinate them. We can also vaccinate older persons, older women, but the cost is slightly higher. So the other one is facilitated by government and other implementing partners. The screening that we do, usually we do amongst women who are aged above 25 years up to 65 years. So you are all welcome, and I call upon you to go to the nearest health facility where they offer these services, get screened where need be, get vaccinated. Let's take our young girls for vaccinations. Let's endeavor to seek care early, and together we shall fight and stop this vice of cervical cancer. Thank you very much for listening to me. Goodbye.